Good evening, one and all. Myself, Dr. Vaneet, working as Assistant Professor in Department of Physiotherapy, Chandigarh University. First, I would like to thank the organizers of this webinar, Movement Maestro Academy, for providing me such opportunity to share my views on the topic of ergonomics in healthcare. Starting with the topic, first, I would like to explain the meaning of ergonomics. So it is a Greek word basically. So ergo means work and nomos means laws. So if you combine these two words, it becomes ergonomics. That means laws of work. If you come to the definition of ergonomics, it says it is the science and the art of fitting the job and the workplace to workers' needs. In layman terms, if we talk, it is basically fulfilling the needs of the workers of the various industries. For example, if somebody is working in medical lab technologies, labs, if somebody is working with optometry labs, if somebody is working as physiotherapist, so what is the need as per his working environment and how to fulfill his or her physical needs as per the demand of the task, that basically is the job of a ergonomist or a physiotherapist who is well aware about the concept of ergonomics. So it is basically the study of work, or it is the way to make the job task fit the employees better. Now, there are various associations which are basically working in the field of ergonomics. So they have also given certain definitions. So one among them is International Ergonomics Association. So how they define ergonomics? It is the scientific discipline concerned with the understanding of interaction among humans and other elements of a system where the individual works, and the profession that applies theory, principle, data, and methods to design in order to optimize human well-being and overall system performance. So you see, this is something scientific, which I already explained you in my previous slide. Okay, it is basically the science and the art of fitting the job and the workplace to the workers' needs. That is the layman definition, which is easy to understand rather than going into some scientific definitions. Coming to the history, it says in the 18th century, the doctors they noted the workers who required to maintain body positions for long periods, they develop musculoskeletal problems and they develop repetitive motion injuries. So those who were associated with the medical fields, it was the thing which was noticed by them. So within last 20 years, the research, it has clearly established the connection between certain job tasks and repetitive motion injuries. So nowadays, a commonly used word is in practice, that is work-related musculoskeletal injuries. So work-related musculoskeletal injuries, they usually occur because of the working environment, because of the abnormal postures. So that actually brings the repetitive motion injuries. Now, in the previous slide, I was talking about uh, the organizations, the associations which are working on the ergonomics. So here I have just mentioned two or three associations which are basically well concerned about the healthcare needs and about the healthcare professional needs. So these are the organizations which are working in the domain of ergonomics mainly. Number one, it is International Commission on Occupational Health. Number two, it is International Ergonomics Association. Number three, it is International Labour Organization. These are the organizations and associations which are giving their inputs time to time. They are organizing various events to just sensitize the people, to sensitize the scientists, to sensitize the healthcare professionals, to sensitize the general public through the webinars, seminars, conferences. And there are so many other job roles of the individuals who are working along with this. associations. Now, why there is a need of the ergonomics? So there are certain amazing facts which we need to keep in mind. You see, when it comes to the need, there are certain facts which actually takes our concern toward the need of ergonomic interventions. You see, when it comes to the facts, what it says, the average person working at a keyboard can perform 50,000 to 2 lakh keystrokes a day. Overexertion and falls are the most common cause of workplace injuries. Number three, average of 1,25,000 back injuries due to improper lifting each year. And number four, muscles overuse result in tiny tears. You see, all these four statements are interrelated basically. So either when it comes to the musculoskeletal injuries, either they are because of the overuse, either they are because of the direct trauma, either they are because of the improper posture. So these are certain facts which actually explains us the importance of accurate work environment, and that is the part of the ergonomics basically. So in the first statement, it is well clear those who are working on the keyboards like computer professionals, they need to do the extensive tasks with the hand. So of course that invites musculoskeletal injury. And similarly, if you talk about the back injury average, you see 1,25,000 injuries each year are coming because of the improper lifting. So these are certain facts which are associated with our day-to-day lives. Right. So one example I have given you of the professional job, and another is example of the domestic job. So this is the, on an average, injury expectancy rate because of the day-to-day improper job tasks or improper jobs paid. Now, coming to the musculoskeletal injury rates by occupation. So why I have chosen this topic for the World Physiotherapy Day 2025 webinar? Why? The reason is well mentioned in this picture. You can see the nursing staff, the attendants, the emergency medical technicians, the paramedics, the paramedical staff, allied healthcare practitioners. They are among the those who have highest number of musculoskeletal injury rates if we go occupation wise, right? Other professionals, they are also having the musculoskeletal injuries because of improper postures, because of lack of knowledge of ergonomics. But those who are working in healthcare industry, they are having the high percentage. This is not my statement. This is the statement after so many researches, right? So you see, what are other professions which are facing similar injuries? Those who are working with the material moving agencies, those who are working with the transportation, those who are working with the driving professions, those who are working as maids, sales workers, construction laborers, janitors, cleaners. See, everybody is having the musculoskeletal injuries. Why ergonomics? Now, the question is well clear. So I hope up to this point, all of you must be able to get what is the need of the ergonomics and what is the relation with work-related musculoskeletal injuries, and how an ergonomist or a physiotherapist can work in the direction to reduce all these injuries. So why there is a need of ergonomics? The goal is well clear: to reduce the risk of accidents, injuries, ill health due to poor ergonomics, to reduce the sickness, absence, then to increase the work efficiency, performance, output. Right. So there's a quote which can clearly bring the attention to our minds. It is feel better and work smarter. With this, we can increase the output of the industry wheresoever the one is actually working. So if you see, everyone in any organization is at risk, and it is not just heavy or physical jobs that cause injury. So our aim it must be, as per my previous statement, feel better and work smart. Now you see, if we are not taking care of our work environment, if we are not taking care of our posture, so what are the health issues which are associated with the poor ergonomics? So these are the issues you can see. So as I was telling you about the health facts, you just see. So poor work related upper limb disorders, they usually occur, back pain injuries, psychological problems, stress, neck pain, back pain. There are so many conditions. Right. So if we are taking care of our working environment, our sitting posture, our desktop level, our neck posture, back posture. So what will happen because of this? So ergonomics and taking care of it, it results in greater productivity, heightened morale, reduced compensation of work-induced injuries. These are the outputs for which the ergonomist, he or she actually works. So these are certain objectives. I have already discussed about the objectives, why there's a need of the ergonomics. So overall, the result is well clear. To improve the quality of life. To improve the quality of life, we need ergonomics. And we need to discuss this topic, ergonomics in healthcare. So already discussed all these points. What will be the benefits of ergonomic program? So of course, certain benefits are there. Work discomfort, it will be reduced, increased general health awareness, improved morale, fatigue level reduction, decreased error and product defects, decreased time required to perform tasks. So of course, if we are suffering with some musculoskeletal disorders, all these benefits will not be available to the one who is having musculoskeletal disorders. Now, what are the factors which affect the ergonomics basically? Workstation design. You see, all of us are working in various industries. All of us are going to various different offices in our day-to-day life. Desk design, chair, space, layout, everything matters. Right. And that is actually varying in each and every office. And that brings the differentiation in the ergonomics. So we cannot say the things what I am experiencing, this another individual will also be experiencing the same. Might be his workstation design is bit better than me. So he's not experiencing such musculoskeletal disorders. So yes, workstation design, the design of the desk, chair, space, layout, everything matters. Work posture. Those who are working in prolonged sitting, prolonged standing, reaching, lifting, that affects the ergonomics. Work organization, pace, breaks, variety. With what pace my organization is working. Suppose if I ask you to compare the education industry with any multinational company. So of course, those who are working in multinational companies, they're working in high pace as compared to that of the education sector. So in education sector, the working hours are fixed, but in MNCs, they are usually not fixed. They also have to attend the evening shifts, night shifts. So without any break. So type of work is different, pace of work is different. So that affects the ergonomics. Then tools, equipment, furniture design. The simplest example, you see, I'm working on laptop, but my office is not providing me any standard laptop stand to put my laptop to adjust as per my job needs. Whereas those who are working in MNCs, if it is this thing is available there, so if you compare both of us, they will be better equipped as you compare them with me. So might be. So differentiation it is there. So what all I mean to say is those who are working in MNCs might be there well equipped, but those who are working in some other uh, uh, professions, like those who are working in medical lab technology field, those who are working in optometry field, might be they are not that much well equipped. So they will be having the greater ratio of the musculoskeletal disorder. So everything actually matters. Right. Then manual material handling. Those who are involved with the more of manual tasks. So ergonomics in them, it will be definitely affected. Then there are certain human factors. So you see, the ergonomics, it does not basically depend upon the common factors, there are certain other factors which vary as per the individual needs, right? So people are different. Biologically, if you see, there are certain human factors, shape and size. The one who are having the height of 5 or 6 feet and the one who are having height of 3 or 4 feet, definitely both of them will be struggling at different level to do the task and to fulfill the demand of the task. Tall and short, shape and size, congenital defect, vision, hearing. So everything actually matters. So these are the factors, biological factors, which actually affect the ergonomics. Then there are certain behavioral factors, attitude, lifestyle. So simple it is. For example, if you talk about myself, I'm not happy to work in multinational companies because that doesn't suit my lifestyle. I'm not in that much capacity to work during the night hours. So my behavioral perception toward that is a bit different. And if somebody forces me to do work in the MNCs, definitely I will be experiencing certain musculoskeletal problems arising because of my job profile. Because I am in education field since last so many years. So people have predictable reaction to various jobs, right? So attitude toward various field, lifestyle, job satisfaction, time pressure, work culture, interaction. So these are certain behavioral factors which actually matter. Then lifestyle influences, obesity, physical fitness, age, gender, of course, everything matters. Smoking, stress, injuries, illness. So, well, I have talked about all these factors which actually can affect the individual ergonomics. Then there are certain environmental factors, heat, cold, lightning. Yes, these matters. So some of us are not capable of working in hot environment. But if we are working in hot environment, that affects blood circulation, causes cramps, burns, rashes, general discomfort. So that is why we prefer to go toward the jobs which are offering us the air conditioners, right? But at the same time, if you are working in air conditioned offices, that also has an effect on body. The effect are well clear, the effect on circulation, hypothermia, flexibility, distraction. So actually everything matters. So that depends individual to individual. So that depends upon physique of everybody. That depends upon individual needs of each and everyone. There are certain other factors as well. You see physical factors, vibration, those who are working in with the drill machines, those who are working with some noisy tools, equipment. So definitely they will be having different types of discomforts and musculoskeletal injuries. Now, that is just the background behind the concept of ergonomics. Now, coming to the ergonomic principles directly. There are mainly 10 principles which we all must keep in mind if you want to keep yourself healthy. Principle number one, work in neutral posture. All of you might have heard. What does this mean? Now, you see, when it comes to the human posture, we are having two things, ideal posture and abnormal posture. So, being a physiotherapist, I usually suggest each and every physiotherapist and each and every healthcare worker to take care of their posture, right? So why? Because our posture, it provides a good starting point for evaluating the tasks that you do. The best position in which to work are those that kept the body in neutral. So that is actually required. So our joint, they must be in the optimal position. They should not be in discomfort. Try to maintain as much as neutral posture as per the requirement of the task. Suppose if your job profile is more of the sitting hours, then you must take care of your hip, knee, and spine. If you are working as a computer professional or in some laboratories, you must take care of your cervical, or your lumbar spine. So principle number one, it clearly says work in neutral postures. Pictures, they can well explain why I'm talking much about the postures of the spine. So that is what I have explained you. So if your job profile is more of the sitting or more of the standing, then these are the things which you need to take care of. These are certain. If you are involved in lifting tasks, then don't bend directly, just bend from the knees. So many things are there which you need to take care of. These are certain images which will help you in understanding between the abnormal and the normal postures. So cervical posture, you can see the third picture is well explaining you about the neutral cervical posture, whereas in picture 1 and picture 2, it is hyperextended and hyperflexed. Here you also can see the first picture is explaining you the awkward position, whereas second is explaining you the natural position. And that is the common mistake which we are doing in day-to-day life. So how to basically use a mobile phone. So you see in the second picture, the usage of headphone is actually taking us toward the neutral posture. Whereas if we are directly working on the receiver or directly on the mobile phone, we need to bend our neck toward the side on which we are holding our mobile phone. Then the recommendations, the next is keep elbows at sides. You see, bad design and good design. So second picture is explaining you if your task is as such that you need to use your upper limb, so how you should keep your elbows. Whereas in first picture, that is giving you the idea if you're using your elbows like that, that will bring the musculoskeletal injuries. Keep the wrist in neutral. So that is the common thing which you need to keep in mind. And of course, everybody of us is driving day-to-day life. So if we are driving, that is how we need to take care of our wrist positions. 10 and 2 o'clock position. It is recommended. Then coming to principle number 2, reduce excessive force. So the things till now what I have talked about is all about the maintenance of neutral posture. Principle number 1. Principle number 2, reduce excessive force. You see, there are two pictures. Now in picture 1, the person is using a trolley to shift the patient from one position, one place to another place. Whereas in picture 2, the person is using wheelchair. So wheelchair is better option than that of the trolleys. Why? Because that requires excessive force to shift the patient. So if our task is getting done with the application of minimal forces, then why we should go toward the excessive forces? You see, despite of pulling or pushing heavy objects, if we are using some power tuggers, wheels beneath the heavy objects, so don't you think that will be a better option? So reduce the excessive forces. Then principle number 3, keep everything in easy reach. The example is well clear. You are doing a job in which to take any object, you need to lean forward every time. And that leaning is for 100 to 150 times in a day. Then why you are doing the task repeatedly? Try to keep that object in your access area. You see, the picture number 2 is well explaining the 3 areas. Repetitive access, you need to keep the object near your body. Occasional access, you can keep the object bit away from your body. And the objects which you do not need, you can put them away. As and when you need them, you can take those objects. So basically, this principle, it deals with keeping things within easy reach. That is all we need to practice. And the things, basically, how we are going to keep the items each and everything that depends upon the frequency of use, sequence of use, duration of use, and force required. Example I have given you, suppose you are working as a clinician, so every time it is not required to lean forward to take a pen or to take a medical equipment from your table. You know, you need this equipment frequently. You can keep that within your reach. So, if you're not keeping that within the reach, what actually will happen because of that, the repetitive injuries will occur. So, that is the next principle. So, this picture, it explains well what I was telling you. If there is some heavy work, then how you need to adjust your table. If there is some light work or some precision work, that is how you need to put the things. So the pictures are explaining well. Now, principle number 5. This principle is just to think about the number of motions you can make throughout a day. Right? So, when we are talking about the ergonomic principles, the next thing is reduce the excessive motion. Reduce the excessive motion. Now, what does this mean? If there is a task which requires frequent motion, so just what all you need to do, you need to basically keep the motions as much as minimum so that the repetitive injuries should not occur. Principle number 6, it says minimize the fatigue and static load. Holding the same position for a period of time increases the static load. It creates fatigue and discomfort. So you need to minimize the things. You need to minimize the fatigue and static load. So this is how we can lift the things in a better way. Next principle of ergonomics, it says minimize the pressure points. You see the picture, it well explains. Suppose if you're working on a computer, you're working in a laboratory, your arm is getting stuck against the table again and again. So that is the point where the pressure injury can occur. Contact stress can occur. You need to avoid that, right? So the job here is to watch out the excessive pressure point and avoid the happening of the excessive pressure at a certain fixed point. Principle number 8, provide clearance. Work areas need to be set up so that you have sufficient room for your head and your knees. So you obviously don't want to have to bump into things all the time. So it is important that you have both adequate workspace and easy access to everything you need. Clearance is needed for your head, arm, feet, knees, and lower. Principle number 9, move, exercise, and stretch. That is actually required. To be healthy, the human body needs to be exercised and stretched periodically in a cyclic manner. Suppose if you are having the prolonged working hours, in between you can spare some time to do the generalized exercises and stretches. Nowadays, it is a common practice in the MNCs. These are the stretches which are usually recommended to keep your body healthy and to avoid the musculoskeletal injuries. Principle number 10, maintain a comfortable environment. This principle is more or less a catch all that can mean different things depending on the nature of the type of operation that you do. So, if excessive lightening does not suit you, then avoid that space. If you need excessive lightening, then ask your job provider to arrange the excessive lightening. Means the approach it should be to maintain the comfortable environment. Right. So that is how the things actually work. And the picture it explains if the task demands excessive light, then this way you can arrange the things as per your needs. So I'm not telling you the things particularly related about physiotherapy, just telling you the generalized principles. Now, these are certain domains of ergonomics which we need to keep in mind. Now, physical ergonomics. It is the human body responses, physical and physiological workloads. Cognitive ergonomics, it deals with mental processes and capacities of human at work. Organizational ergonomics deal with the organizational structures, policies, process. So everything matters. Cognitive, organizational, physical, every type of ergonomics, it matters to avoid the work-related musculoskeletal injuries. Now, since beginning, I'm talking about the type of injuries which can occur because of the improper ergonomics. You see, these are the common things: muscle pain, joint pain, swelling, numbness, restricted motion, repetitive stress injury, repetitive motion injury, cumulative trauma disorder, musculoskeletal disorder. So these are the things which are occurring because of improper ergonomics. So they are classified as ergonomic injuries, cumulative trauma disorders. And another one is stress and strains. So these are the things happening to our tendons, nerves, neurovascular structures, muscles, bones, which are bringing pain to our body if we are not taking care of the ergonomics. These are certain ergonomic risk factors which I have already discussed: contact stress, awkward posture, force, vibration, repetition, static load. So which invites the musculoskeletal injuries. So hope I am able to give you the idea about the key principles of ergonomics with which you can avoid the work-related musculoskeletal injuries which are occurring because of improper ergonomics. Right. So here I would like to end the presentation of the day, and once again a very happy World Physiotherapy Day to one and all. Thank you.